Dr Murphy, thanks for your time today.
Pleasure.
Just to get it out of the way, vaccine misinformation. Can you briefly answer with sort of yes or no kind of answers and dispense with some of this nonsense for us? Is hydroxychloroquine the answer to stopping the coronavirus pandemic?
There is no current evidence that supports a role for hydroxychloroquine and stopping the coronavirus pandemic.
Are any of the vaccines dangerous or going to kill you?
There's no evidence at all that any of the vaccines are dangerous or would kill you. They're all very, very carefully tested by our TGA, which is one of the best regulatory authorities in the world.
Is the health risk of side effects from any of the vaccines greater than the health risks to the community of COVID?
There's no evidence to support that, and we now have quite good evidence of the vaccine rollout in a number of countries where they've needed to do it in an emergency situation, and the evidence suggests that whilst there are some minor side effects, serious side effects are very, very limited, and the risk is much greater of the disease than being vaccinated, much greater.
Have you ever raised with the Prime Minister concerns about politicians like Craig Kelly spreading misinformation?
No, I haven't personally raised concerns with the Prime Minister. I'm on the record in parliamentary committees saying that I think everyone should follow the expert medical advice in their views.
And just to wrap up, what is your message to any Australian who might be legitimately worried, thinking, look, this has all happened pretty quickly, I'm sort of worried, is it going to be safe to have a vaccine? What is your official advice on that?
My official advice is that we have deliberately gone through the normal full range of regulatory approval for our vaccines because we're in such a good place in this country with no community transmission. We've been able to do the full safe regulatory approval. The Pfizer vaccine is approved, and we hope the TGA will approve the AstraZeneca vaccine in coming weeks, but we have not cut any corners and we will not register a vaccine unless we're confident about its safety.
Okay, so that aside, is Australia going to get to herd immunity using the AstraZeneca vaccine, given that some of the other leading vaccines have greater efficacy?
We don't know whether any of the vaccines will give us herd immunity. That's our goal. All we know at the moment is that the vaccines are very good, all of them, at protecting against clinical COVID disease. There is less data on the AstraZeneca vaccine in the phase 3 trials, but there's more data coming, and the data coming just recently out of the UK suggests that they are getting a very good benefit from that vaccine. We are confident that both the Pfizer vaccine, the AstraZeneca vaccine and later the Novavax vaccine are all good at preventing clinical disease. We will only know over time whether they prevent transmission of the virus and give us herd immunity. We don't know how long the immunisation will last for, and we don't know what any of them will do on the transmission of the virus. That information will come in time. Our strategy at the moment is to protect our population against COVID disease, and both vaccines are very good at that. I'm going to have the AstraZeneca vaccine. I'll be very pleased to have it.
Novavax has had better results than AstraZeneca, but we aren't producing it locally. Why not?
At the moment, CSL, who is our only local manufacturing plant, have been focused on producing AstraZeneca. And as I said, it is a vaccine that there have been billions of doses of AstraZeneca ordered around the world in many, many countries. It's a very good vaccine. Novavax has some preliminary data too, but all of the vaccines have only got phase 3 trial data. We'll get more and more data, big data coming out of a US trial on AstraZeneca soon. So Novavax has on its preliminary phase 3 data good results, but I think AstraZeneca is a very strong and good vaccine.
A couple of weeks ago, you were asked why Australia isn't getting any of the Moderna vaccine, and you implied there was an issue in negotiations. Why aren't we able to get supply from them? All of our vaccine purchases have been guided by a scientific and technical expert advisory group, which I chair. That group made a decision before any of the phase 3 data was out to make a strategic investment in Pfizer, which we did. We continue to review our vaccine portfolio, and we're continuing to have discussions with several major vaccine companies. And we also have access to a number of vaccines through the COVAX facility. So at the moment we've got 3 times population coverage with the vaccines we've got. We know those vaccines are good, but we will continue to explore our vaccine portfolio and may make additional purchases in the future, but we can't detail the commercial and confidence discussions with all the vaccine companies.
So to be clear, are we currently involved in negotiations to try to secure more doses of vaccine from any of the leading candidates?
We are continuing to discuss with a number of companies, and we will continue to get advice from our scientific and technical advisory group to see whether, despite the fact that we've got very good population coverage as extra insurance, we may get some more doses of some vaccines. But I can't detail anything more than that, other than to say we are continuing those discussions and continuing to get advice from the Scientific and Technical Advisory Committee.
Why are we slower at rollout than, say, Israel? It's already administered 5 million doses to its 9 million residents, and they're not even manufacturing locally.
The decision we made, unlike a lot of other countries, including Israel, who have community transmission and have an urgent need to get going early, we decided that to get the confidence of the people in Australia, because we had no community transmission, we were not going to do anything other than our full normal registration process. That's been the major reason why we are starting later than some countries. We have not had that burning platform.
Dr Murphy, thank you very much.
Pleasure, Leigh.
Hi, I'm Leigh Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.